All right, hey everybody, back again. We're going to talk about some of the immune products, and what we're going to start with today is vitamin A. As I mentioned in the previous video, we're going to talk about quite a few different areas. Vitamin A is something that is big right now. It's one of your essential ones for immune support. Why is it so essential? Everybody's wondering, what is the key thing with that? Well, vitamin A is essential for producing what's called your epithelium. So epithelium is the outside part of your hand. It's also the inside of your tube. We're basically a big tube from our mouth all the way out to the other end. So that tube needs protection, and that protection is the epithelial tissues. If you don't have vitamin A, you don't make epithelial tissue. That's why people that have commonly poor hands, or they get a lot of psoriasis is one of the vitamin A products is one of the common ones I'll use with psoriasis, where people have a lot of skin conditions. A lot of times look to vitamin A, very foundational level. Just like any sporting team, you start with the foundation, you work your way up from there. I have other products that are my favorites for immune support, but I always evaluate vitamin A status as a key player with that. The other big thing about vitamin A is it also makes mucus. So we view mucus as something that is unimportant or annoying, particularly if we get allergies, that sort of stuff. But mucus is essential because it actually acts as a barrier to pathogens or bad stuff that comes in our body. So if we're dealing with a virus or bacteria, that mucus that is in our sinus cavities actually acts kind of like quicksand. It slows down the arrival of those pathogens, prevents them from getting in there. And so that's why when we're having an allergic reaction, everything gums up. It's trying to slow down the intake of those substances that are giving us trouble. So that's why you get all congested with that. Same thing with any cold or flu or viral type thing. You get really congested, and that's your body trying to deal with it. So that's why mucus formation is very key. And you also need vitamin A for that. You don't have vitamin A, you don't make mucus. So those are our big kind of reasons we would need vitamin A. Also, the other big reason is that it is a trigger for our white blood cells, which are also our kind of our foundational support from our immune system. It acts in various mechanisms within there. We can get into the technical side if people want as far as that goes, but it acts to help to activate our white blood cells. So really key. So it works on those three components. So vitamin A is necessary for white blood cells. It's necessary for mucus formation, necessary for epithelial formation. All tremendously important. In particular, when we talk about gut issues, which many of you know is kind of one of my babies that I teach on and that I work with quite often, is GI problems. And normally the gut membranes, the epithelial tissue within the gut, normally it's a tight junction. And you'll get inflammation. What causes inflammation? It could be sickness, it could be too much alcohol, it could be non-steroidal anti-inflammatories can cause it too, where the gut membrane will literally separate from inflammation, and then pathogens will pass through that normally shouldn't. That's where your mucus levels are very important. But the key is with our tube that comes down from our mouth all the way to the bottom, it's only one cell layer thick. So that's why the mucus is really important to protect us. And if we don't have that mucus, we don't have that protection. So we need to get vitamin A. Now, in terms of formations of vitamin A, what types of vitamin A? I like the retinol version because it's complete, it's ready to go. The retinol version is the kind that's found in things like eggs. It's also found probably in its highest concentration in liver. That's something that a lot of people ate when they're young. That's one of the things when I teach in my classes, I say, how many of us eat liver on a regular basis? Show of hands. And there's not very many people. Believe me, my hand doesn't go up. I'm not a huge fan of liver, but I ate it a lot as a kid. I don't really do it anymore now, here or there. I eat Braunschweiger, which is processed liver, but otherwise I don't typically eat it. And most people are like that. Now, what's interesting is you talk to some of the people, the next generation before us, how much did you eat liver? Oh, every week we had liver with my parents. And then you look at the great grandparents, how often do they eat liver? And it's not just liver, it's other organ meats that commonly were ingested that we don't do anymore. So because of that, we're missing some of the nutritional components that ancestrally, through our DNA chain, that we consumed all the time that we don't do anymore. So that's why we need to get some of these other forms in our body. So what can we do? What other forms can we do? Well, so besides the eggs, besides liver, Cod liver oil is one of my favorite ones to take. I recommend that. I periodically will supplement with it myself. Great source of essential fatty acids too, so it kind of kills two birds with one stone. So a really good thing you can do. The only problem is the pills tend to be about that big, so they're pretty big, but it is an effective thing to do. Otherwise, you get into your brightly colored vegetables, in particular things like your carrots, and we're looking for what we call the carotenoids, which are a precursor to vitamin A production. So normally your body will make vitamin A through beta carotene. That's why you often see that in supplements, but it's not very active compared to the retinol version. It's about 1/12 of the activity. So one of the things we'll run into is people will eat a serving of carrots once every 2 weeks, and you're not getting the vitamin A. You're not eating these other foods rich in vitamin A, so you run into it. So green leafy vegetables are key. The carotenoids are key. Those are rich sources of vitamin A. So I always tell my patients, if you can do a salad a day, that's one of the best things you can do because you're getting lots of trace nutrients, in particular these phytochemicals and the carotenoids, which is what's going to help you make you healthy. So with that, we'll end on vitamin A. If you have any other questions, let me know. We'll get into it further. But as far as the dosage, that's the last thing I'll cover. There's some debate. Do you go mega dose on it? Vitamin A can be stored. It's a fat-soluble vitamin, so you have to be careful. Do not take high doses for a long period of time. High doses should be short, window maybe a few days, maybe a week. I don't recommend you stay on high-dose vitamin A. I've seen some places out there recommending 25,000 IUs a day, which would be equivalent of what's called retinol equivalence of somewhere around 3,000 or 4,000. That's the new labeling. So that's really high, so you want to stay away from that. So ideally about 2,500 IUs is kind of your baseline level. If we're deficient, if we're trying to get healthy, I would maybe recommend 5,000 for a period of time. I've gone as high as 10,000 with people that are really deficient or are sick. So those are things that we can do. So amp it up a little bit, but keep it short term, and then go down to your maintenance dose. Like we said, you can find those charts online very easily about regular levels. So with that, have a great rest of your day.